My name is Michelle Holt-Shannon, and I run New Hampshire Listens at the Carsey School of Public Policy. And when I look back at this year and our work, there are three things I'm really proud of. One is the work that we did to support the Commission on School Funding in New Hampshire. One is a lot of different kinds of work on race and racism. And the third is this work on the Civic Health Index. It's been a lot of work, and I'm thrilled that the day has come that we get to share about it, especially knowing all that has gone into this report. I want to thank all of you who are joining us. We have representatives from our federal delegation, from New Hampshire House and Senate. Many of you are in public service in the Granite State, and some of our closest partners out there. I see you. I want to lift up the amazing work of Laurel, Lloyd, and Nick Gosling, and Dr. Carrie Portree, whose contributions made this report more beautiful, online, and accurate as it moved into production. And I really want to thank as well all the great folks at the National Conference on Citizenship. So deeply appreciate all the time that you spent. I also want to thank our Civic Health Index Advisory Board members who you'll meet later in the program. We are deeply grateful to our partners at the Endowment for Health, New Hampshire Charitable Foundation, and Campus Compact New Hampshire for their financial support. You've made it possible for the Carsey School to provide this essential service to the state, and your own work to advance civic health in our communities is making a significant difference in the lives of everyday folks. So thank you very much. We are thrilled to have three panelists with us here today. After Quixada's presentation, we look forward to their initial wise and wonderful reflections. Dr. Yvonne Goldsberry, the president for the Endowment for Health, Pedro Altagracia, Chief Diversity Officer with Easter Seals New England, and Dick Ober, president of the New Hampshire Charitable Foundation. So thank you all very much for being with us. And finally, I want to say a word of thanks to Dr. Quixada Moore-Vissing and Dr. Bruce Mallory. Quixada, I'm going to say more about you a little later on after the program, or a little later on in the program. But for now, I just want to honor and appreciate my co-founder and partner in crime, Bruce Mallory, for his tireless support for stronger and more equitable communities. Bruce has dedicated his life to equity and engagement, and New Hampshire is the beneficiary. He's out on medical leave, but we fully expect him to be back and doing his good work again in the coming weeks. So we have an agenda for you. First, Dr. Quixada Moore-Vissing is going to share some of the outcomes and results. We'll have a great conversation from our panelists, respondents, and then invite advisory council members in who've been advising the Civic Health Index in New Hampshire, and then open it up even more and hopefully keep a very engaging conversation going on as we go. I'm going to pass it now to Michael Ettlinger. Michael is the director of the Carsey School. He's an economist, a lawyer, and he's someone who I know is deeply passionate about anything that reduces inequality. So I pass it to you, Michael.
Thank you. Yeah, and I'll be very brief. Someone needed to thank Michelle. So thank you, Michelle, for your leadership of New Hampshire Listens. We at the Carsey School are very proud of New Hampshire Listens and all the things that you listed. And also just add my thanks to everybody who worked really long and hard on this really important report and who supported it in various ways, which you've already listed those people. But I mean, it is really important. You know, there's the saying that if you don't have your health, you don't have anything. And I think really we've seen over the last few years that that's not just true of people individually, but true of society and civic health. And it's really hard to address problems if you can't itemize, if you can't measure them, and if you don't, you know, get into the weeds of them and understand all the nuances and things that affect our health. You need to measure things for the diagnosis, if you will. And that's to some extent really what this report does. Is it's a diagnostic tool for the civic health of New Hampshire. And I think if we want to sort of cure what ails us as a society in general, and in New Hampshire, we need diagnostic tools like this. So I think it's a terrific piece of work, and I think it's going to really make a big contribution in the state. So I'll leave it at that, and I'm kicking it over to Quixada, who's the Associate Director of National Programs at Public Agenda and a fellow at the Carsey School of Public Policy. Take it away, Quixada.
Great, thank you, Michael. I'm just going to pull the slides back up. So good afternoon. Thanks everyone for joining us today. I'm thrilled to be sharing the Civic Health Index with you. I want to thank all my colleagues at New Hampshire Listens and the Carsey School for helping this moment to be possible. And most importantly, my co-author, Bruce Mallory. This is the 4th New Hampshire Civic Health Index, and also the most in-depth one. What we have found over time in doing these civic health reports is that overall New Hampshire has a history of strong civic outcomes. There's lots to celebrate as a state, and this trend continued in the 2020 index. However, in this index, we also identified some risk factors for our future civic health. The data we used in this report were collected from 2017 to 2019. When we consider how the events of 2020 may have further eroded our civic health nationally and as a state, our risk factors may escalate quickly if we aren't careful. So in other words, we have an opportunity here with the Civic Health Index to reflect on our assets as well as these warning signs. This opportunity for reflection is critical to ensuring the Granite State continues its rich history as a hub of political and civic activity. So I wanted to start with sharing a definition of what civic health is. So civic health consists of behaviors, beliefs, and actions related to civic and political engagement. And this is really everything from voting habits in the state to how much people talk with their neighbors to how much they trust public institutions and feel they matter to their communities. The Civic Health Index is like a regular checkup at the doctor where we assess the health of civic life in a given state. States all around the country are compiling these indexes in partnership with the National Conference on Citizenship. So why are these indexes useful? If we think of our physical health as a comparison, if we're lucky, our doctor tells us that everything's humming along as it should and that we have a clean bill of health. Often our doctors tell us that things look pretty good, but we might want to watch for some risk factors. But sometimes we hit a crisis point and action around our health needs to be taken immediately, or there could be dire consequences. We can think the same way about civic health. What we are hoping for is that the index shows us that people are engaged, our public institutions are responsive to our residents, and our communities are strong. But when this isn't happening as well or as often as it should, we need to think about why. And sometimes when we don't pay attention to risk factors, the result could be a polarized, isolated, angry, or even violent community. We've gotten a taste of what that can look like as we've observed other countries across the country struggle with these civic crisis points. And like a physical health crisis, the consequences can be very serious if we don't pay attention. Doing these checkups every few years helps us to have longitudinal data where we can make comparisons over time. My co-author, Bruce Mallory, and I wrote the last Civic Health Index in 2012, and we have seen certain trends continue over the years. For example, one thing we have seen over time is that the amount of education you have impacts the strength of your civic health. So essentially, people with more education are more likely to vote, volunteer, go to public meetings, and feel they matter to their community. And that's just a few of the outcomes. Actually, we see a relationship with education across almost all of the civic health outcomes, and we'll talk about that today. So I wanted to share a bit about the data in this report. So state civic health indexes are generally compiled from the US Census Bureau's current population survey data. In this 2020 index, we wanted to know even more about civic life in New Hampshire. So we also collected some of our own original research through the University of New Hampshire's Granite State Poll. In the Granite State Poll, we replicated some questions about trust from the Social Capital Community Benchmark Survey, which is a national tool that Robert Putnam and other scholars helped to develop. We also created some of our own original research questions about if people feel they matter to their community and if they had received civic education in their K-12 schooling. If you want to see the full list of questions we asked, they are available on the Civic Health website in the primer document. And Carrie, I don't know if we can also chat a list of all the variables for people to see if they're interested in seeing all the variables in the report. In this Civic Health Index, we decided to really explore demographic data because we wanted to see if there were disparities in how different populations in the state were experiencing civic health. So in other words, if you have a certain background, like you're young or you have a low income, are you more or less likely to have strong civic health, and why? So because we used two different survey instruments, there were different data available for each tool. For the census, we were able to look at demographics by educational levels, generation, geography, and income. In the Granite State Poll, we were also able to look at educational levels, age, gender, region in the state, political party, if someone voted or not in 2016, if they attend religious services, and what media outlets they gravitate to. So as I shared these demographics, many of you probably picked up immediately on the fact that we don't have data about how different racial and ethnic groups experience civic health in New Hampshire. And I want to explain why this is. Although we have become an increasingly diverse state in recent years, particularly in our youth population and in some of our more urban areas, overall, the majority of our residents still identify as white. In both the census data and the Granite State Poll, people of color were surveyed, but basically they are a small percentage of the survey respondents overall. So we don't have enough data statistically to make reliable inferences about the experiences of color by their race and ethnicity. Since it's really important to understand how different racial and ethnic groups experience civic health, I would recommend that we do some follow-up research so that we can learn about the experiences of people of color in the state. Similarly, another data point we are missing in this research are the experiences of youth who are younger than millennials. We have a little bit of this information, but not as much as we would like. And this was the same issue as the racial and ethnic data, where there were just not enough people surveyed from Gen Z or younger populations to draw conclusions by these age demographics. And then one more consideration with the Civic Health Index is that this is state level data. So in order to know how individual towns in New Hampshire experience civic health, we would have to do follow-up research. My co-author and I created a tool to help people collect civic health data at the local level. And we can talk about that toward the end of the presentation. And I believe if we haven't, we can share that in the chat with you now. We also call it the primer. So I'm going to ask you to put on a special thinking cap with me as we review the key findings from the index together in a moment. All the data in this report were collected pre-pandemic, and we have gone through a lot in the last year. And we can probably all agree that society is never going to be quite the same. So what I would like to try to do here is think about where this data signaled we were heading before 2020, then to think about the events of 2020 and consider how that might change the picture of civic life that we see here. Part of the reason that I would like to do this is that there's research that shows that closer knit communities are more resilient in the face of crisis and recover faster from setbacks. So making predictions together for our civic future may also help us to recover more quickly from the challenges we've experienced in the past year. So here are some questions, if you can put on your thinking caps, that we can think about together as we explore these findings. And the first is, given what we know about our civic history, what predictions can we make for our civic future? How might the events of 2020 change the findings you see in this index? What civic interventions do we need to take to ensure we maintain our civic strengths and address our red flags? So now the data. So the big picture is New Hampshire's civic health is strong overall. So as you can see here, New Hampshire continued to exhibit some strengths, leading the country in the top 10 in several areas. And this is a trend that continues from what we found in the 2012 index. So to share a little bit more, we were second in the country for charitable giving of $25 or more. We were 5th in the nation for voting in the 2016 election. And although we don't know our ranking yet for 2020, we also had strong voter turnout in that election. We were 5th for interacting frequently with family and friends. 6th for attending public meetings. 7th for talking with family and friends about political, societal, or local issues. And we were volunteering at our highest rate since 2002. In the midterm elections of 2018, we had our highest voter turnout since 1978. Most people in the state reported they feel they matter to their communities. And the majority of people in the state feel that they can make an impact on making their community a better place to live. So these are all things to really celebrate about our civic health in New Hampshire. But we have some warning signs that we need to pay attention to. So we are in the bottom 5 states in the country in terms of engaging with people of a different racial, ethnic, or cultural group than our own. One thing I want to say about this data point is it's not just a measure of proximity. This measure also looked at how much people interact in person, but it also looked at how much we interact with people online or on the phone. As you saw on the previous slide, although we connect frequently with family and friends, we aren't doing this nearly as much with our neighbors, so there's a disconnect. For instance, we were 5th in connecting regularly with family and friends, but 38th in doing so with neighbors. We were 7th in talking about important issues with family and friends, but 33rd in doing so with neighbors. We rank 40th in doing favors for neighbors, and we rank 45th, the bottom rung in the nation, in terms of helping people outside our immediate family with food, housing, or money. And our trust in our neighbors is also declining. So you can see here, the blue bars are 2001 and the orange bars are 2019. And people who trust their neighbors a lot fell 10 percentage points. And you can see on the right here that there's an increase in us not trusting our neighbors. So what this all tells us is that we are tending to keep to our immediate social circles, but not really expanding much outside them into our communities. And it's not just trust in our neighbors that's declining. So you can see here that their trust in both local and national government has decreased since 2001. The drop in trusting national government has been much more pronounced. It has fallen by half, from 30% to 14%. And I will remind you again that this data was collected before the pandemic. So we did see a few themes in our data, and these themes are made clear in the full report through lots of graphs and further analysis, which is more than I'm able to share with you here today. So I hope that you will delve into the details of the report. But one theme we have seen clearly, both in the 2012 index and now here in 2020, is that there is a relationship between educational levels and civic health outcomes. And we see this across almost all of our civic health indicators. Education overwhelmingly has the most impact of any variable. And by educational levels, I mean if someone has a high school education or a college degree. So essentially, the more education someone has on the spectrum, the more strengths they demonstrate in civic health. As a couple examples, people with a college education vote, volunteer, trust their communities, pay attention to news, and feel they matter more to their communities than people with a high school degree do. We also saw that civic education in K-12 schooling impacted civic health outcomes. So overall, our survey data reflected that 81% of Granite Staters reported they received civic education in either elementary or secondary school. And we saw some interesting relationships with civic education. So people who had received civic education were more likely to vote in the 2016 election. They were more likely to feel they matter to their communities. They were more likely to feel that people like themselves could have a positive impact on their communities. And we also asked people if they knew how to become involved in problem solving in their communities. And what we found is that civic education also had an impact on that outcome. So what's interesting about all this is when you look at income and civic health outcomes, there are not the same clear trends as there were in education. There's actually a lot of variability when it comes to income and civic health. I'm going to share just a few examples here, but there's a lot more in the report. And I believe that my colleague can chat out our income groupings for your reference if you want to see how we categorize low income, middle income, et cetera. So here's some of the things we found. Low income people are doing more favors for neighbors than other income groups. Lower middle income individuals are engaging more with news than other income groups. Higher income folks volunteer more than other income groups. In the presidential and midterm elections, higher income individuals tended to take the lead, but in local voting, lower middle income and higher income folks voted at about the same rates. And another interesting fact that we found was out of all the income levels, we saw two groups leading in civic health strengths. One was higher income people, but the other was lower middle income people, which some people might refer to as the working class. So to recap, as educational levels increase, civic health outcomes tend to increase. But when it comes to income levels and civic health affect each other in differing ways. So what this tells us is it's really education rather than income that's making the bigger difference, although income does have an effect on civic health outcomes. In terms of voting overall, when compared to the rest of the country, we are voting at higher rates in New Hampshire, and this has been true over time. However, our voting trends have shown a lot of variability in recent years. So when it comes to presidential elections, up until 2016, we were seeing a steady decline in voter turnout. In 2016 in particular, we saw our lowest voter turnout in over a decade. But then in the 2020 election, we had the highest voter turnout we've seen since 1964. We've been seeing an uptick in midterm elections since 2010. In the last midterm election in 2018, we saw the highest voter turnout since 1978. So basically, lately, we seem to be trending toward higher voter turnout in national elections. And these changes in turnout are likely indicative of the broader political landscape we're living in, both in the state and in the nation. I do, however, want to point out that not all demographic groups in New Hampshire are experiencing voting the same way. So we saw a lot of differences by demographic groups and their voting habits. In particular, people with lower incomes and lower educational levels are voting less. And one thing I wanted to highlight in particular is there's a connection between people who voted in 2016 and people who experienced barriers to engagement. So for instance, 97% of people who reported work or childcare as a barrier to their civic engagement also reported they did not vote in 2016. One of our other key findings is that millennials tended to demonstrate lower civic health outcomes than other generations. Millennials tend not to connect with their neighbors as much, and they trust their neighbors much less than other age groups. They're attending public meetings and contacting public officials much less than other generations. Millennials are engaging much less with news than other generations, and people under 30 are voting less across the board in both national and local elections. I'm not sure what the final word on this is for the 2020 election, but this is what we found prior to 2020. We also found that people under 49 tended to report the most barriers to engagement, and that people who were 18 to 34 experienced these barriers the most acutely. One place where millennials did demonstrate some strength is in connecting with friends and family. So they actually led all generations in this category. So what this suggests again is there seems to be a disconnect broadly and in particular with millennials in connecting with their inner circles and not as much with the broader community. So part of the Civic Health Index includes a series of reflections about civic health in New Hampshire. And I don't have time to go through all these reflections in depth today because they're quite extensive, but I did want to share two of them with you. And if you'd like to check out the full list of reflections, I can put a web link to that in the chat in just a moment. But the first reflection I wanted to share is that the Civic Health Index showed us that different demographic groups are experiencing civic health differently, And we're in the 46th in the nation for interacting across race and ethnicity at the same time that we are an increasingly diverse state. So this all speaks to the fact that we must find ways to bring people together across different identities. And I think that this will take both local and state level efforts. As Jonathan Haidt has written, the only cure for bias is other people. And another reflection I wanted to share is that trust has eroded over the past 2 decades, both in public institutions and within communities. So we really need to be thoughtful about how to rebuild trust in both of those areas. So depending on your preferences, we have several options for you to learn more about civic health. The full report is very in-depth. We really just grazed over the main ideas today, so I hope that you will check it out. And we have both a website for the report and a PDF that you can print, depending on how you like to read information. We also created an executive summary for those of you who want to know the bottom line, but don't want to get into the details of the full report. And then to address the issue of collecting local civic health data, my colleague Bruce and I designed this document to walk communities through how to collect their own city or town level civic health information so that they can learn more about how their community compares to the state and identify local civic assets and challenges and design that, that can help to stimulate designing your own civic interventions of some sort. So that's important work to be done. So to queue up the discussion and the next steps for this launch today, I wanted to just surface a few questions. And I'd really like to hear from participants about what they think about these questions. So one question is, what actions do we need to take now to keep civic health strong in the state? What actions should we be taking to address our civic risk factors? Who should be doing this work? And what do we need to get this work started? And then finally, what follow-up research do we need to really understand New Hampshire's full picture of civic health? And one thing to think about is that we don't currently have data about civic health post-pandemic or during pandemic. So just something to think about. So again, I'm Quixada Moore-Vissing. I'm a Carsey School Fellow at University of New Hampshire with New Hampshire Listens. My full-time job is with Public Agenda, and I'm also on LinkedIn. And my co-author, Bruce Mallory, can be found at UNH or on LinkedIn. So feel free to find us in those places if you have further questions. Thank you so much for being here and for caring about civic life in New Hampshire. And I will turn it back over to Michelle. Michelle, I think you might be on mute.
Thank you, Quixada, so much. I really appreciate what you've done here. It's a big piece of work and a really important thing for the state. Quixada Moore-Vissing has been with New Hampshire Listens almost from the beginning, I would say. And it was one of our first fellows with New Hampshire Listens. And I just want to share a thought from Bruce. He says, I am indefinitely grateful to Quixada for being my partner and co-author in the civic health work over the last 9 years, and especially for her taking so much of the lead on our 2020 edition. Her analytic and writing skills made a huge contribution to this edition. It gives me great joy to know that she will continue to lead this work into the future. So thank you, Quixada, for everything. It's a joy to work with you, and I'm really glad you are here today. I am going to we're going to take the slides down and bring in our panelists. We've asked 3 people to spend some time with us sharing their thoughts on the implications of the Civic Health Index. Dr. Yvonne Goldsberry, Pedro Altagracia, and Dick Ober will share their bios in chat. These are 3 people you should know if you don't. But I know that Dr. Goldsberry is going to kick us off, and then they've connived with each other about the order that they will speak in and share some initial thoughts, and then hopefully they'll treat us to a little bit of banter back and forth between them as well. So Dr. Goldsberry, thank you.
Great, thank you, Michelle. And hello to Dick and Pedro. So I will start off with some brief remarks, and then I think Dick has some remarks, and then Pedro, and then we look forward to just chatting with each other. We had a nice pre-conversation, so I'm looking forward to continuing that today. But first, let me echo my thanks to Quixada and Bruce for their work on the report, and also to the Carsey School of Public Policy for supporting it in the National Conference on Citizenship. Without them, we would not have this rich data available in our state. And at the Endowment for Health, you all should know, and if you don't, we work to assure that New Hampshire communities are offering all people an opportunity to feel safe and welcome, and that they thrive, and that geography doesn't just define how people live. So we're acutely aware of the connection between civic health, physical health, and mental health. So as Quixada noted, there's some bright spots in the report, but also some challenges and barriers to civic participation, and that this varies across demographic groups. Many of the issues examined in the report are drivers of health for individuals and communities, including involvement in the community, maintaining social connections, having a sense of belonging, and trusting others. So looking at these measures of civic engagement, community connections, and volunteering is really important to the work that we do at the endowment. And I find it interesting that the same barriers to good health end up being barriers to full civic health. So there's a clear connection between what we often call the social determinants of health and what I might characterize as the social determinants of civic health. So that's to say, the things keeping New Hampshire people from getting involved in their community, as noted in the report, work schedules, childcare, lack of information, lack of transportation, and feeling unwelcome. All these things are things that create access issues to health and healthcare. So there's a direct relationship between these two issues and areas. We need to work on both of them together. In addition, low educational attainment is associated with poor health, just as it seems to be associated with lower civic health. They're directly related, so we need to have these conversations together. But I think the items in the report that most trouble me are those about the declining levels of trust in our neighbors, our social institutions, local media, and in government. And while the data applies to 2020, we could see these trust issues play out this year in the COVID-19 public health crisis. So distrust in government clearly played out in making the public health emergency orders much more difficult to implement. People questioned evidence about masking, social distancing, and vaccine efficacy. We count on these things in public health. They're core public health measures. And the public part of public health is an essential function of government. So to the extent that we can't trust our government, we also can't fully implement well public health measures. Another troubling thing to me is distrust in local media. So here in New Hampshire, our local media has been the source of information for state level information about COVID-19 and vaccine information. So eroding trust in local media eroded the response to the public health emergency. And to the extent that our local media outlets have been struggling in the last several years with competition from online and national sources, the ability to rapidly move local information is compromised. We have a problem when we can only receive and trust online or national sources of information. So in New Hampshire, people jumped at opportunities to volunteer in large numbers this past year. They made masks, they helped out at food banks, and that corroborates the information that we heard from Quixada about volunteering. But declining trust in our neighbors is very troublesome at a time when the public health crisis needs a collaborative participation to slow the virus. So this past year with the pandemic and significant social unrest, we add what I'd call community trauma to this declining trust. Illness and death, economic distress, and social isolation added stress to individuals and community. And while stressful on everyone, the pandemic disproportionately impacted lower income people, who are the same people in the civic health report who are less able to participate in civic life across many of the indicators. And I know Quixada has some details on which indicators that's very true for and which indicators that might be less true for. But in New Hampshire, these are the same people that suffered. They are in lower paying jobs, and in our state, as the hotels and restaurants closed, they were very much impacted, and they're the last jobs to rebound post the pandemic. So what we see is the people with the least voice in our civic life are the most impacted by the crisis. So as we focus on the recovery from the pandemic, we need to think about building our civic health so that many of the markers of a strong civic health that are related to community resiliency can help us bounce back. And as Quixada mentioned, community resiliency is really important, and the civic health data helps us be sure that we can measure that. The same communities that were less able to engage civically are the communities that are going to have the most difficult time rebounding and recovering from 2020. So strong civic health is key to creating ongoing, sustainable, thriving communities for all people who live in New Hampshire and call New Hampshire home. So I'm looking forward to today's discussion and very much welcome the information offered in the report. And again, thank you so much for doing the report. I think I'll pass the mic to Dick at this point.
Thank you, Yvonne. It's really good to see you all. And, I'm like you, I'm getting a little weary of seeing little dots on screens, and really looking forward to the time we can be together to continue to build social capital. So I work with the New Hampshire Charitable Foundation. We are New Hampshire's community foundation, and we're committed to strong, resilient, and just communities based on a wide spectrum of issues that we engage in. And I'll touch on that in just a minute, but I'll start where Yvonne did, and that is just a huge thanks to Quixada and Bruce and Carsey for this report. We've been pleased to be a part of it. No single report can cover such a broad topic like this. And as Quixada said, there's real data gaps in New Hampshire, but this civic index is a major contribution. When Yvonne and Pedro and I were conspiring about today, we were frankly talking about how much we love New Hampshire, and that love means being as honest about its flaws as it is its strengths. And as Quixada said, and Yvonne pointed out, there's encouraging numbers here, but there's also some warning signs. So I've got 3 points today. The first is what I have called for a number of years the New Hampshire paradox. In many measures, including this report, our high average ratings tend to mask and obscure very significant gaps. So this report, as Quixada said, shows high levels of numbers of people who are giving, voting, volunteering, connecting with friends and family, attending public meetings. Most New Hampshire residents feel they matter to their community and they can make an impact. All that is really positive stuff. But then you dig deeper, and the measures vary widely based on a number of factors: income, age, and education. So I'm going to give you some examples which Quixada also named, but it's worth emphasizing these. So people with lower incomes are more likely to help their neighbors and more likely to discuss politics than people with higher incomes, but they're less likely to vote in national elections. Age obviously matters. This finding about millennials who are much less engaged in civic activities, we're one of the oldest states in the country. This is a major problem. We already export 60% of our college-bound high school graduates to other states, and we are not taking care of our younger people who need opportunity to stay here. Young people are not going to want to stay if they don't feel connected. Education, best predictor of civic engagement, and overall, New Hampshire people are really quite well educated compared to the rest of the country. But the quality of public education in this state varies tremendously from place to place, from district to district, because of the terribly unfair, inequitable way that we fund public education. You know that has to lead to sharp differences in civic engagement based on geography. This report couldn't go down to the local level, That's why we're intrigued about the idea of doing community-based civic health indices so we can test that assumption at the local level. But geography has to matter because education quality matters. So this finding about New Hampshire people ranking 5th in connecting with family and friends, but 38th in connecting with neighbors. So we tend to self-gerrymander we tend to live closer to people that look like us and think like us and believe like us and worship like us. So we're 38th in connecting with neighbors and 45th in connecting with people of different racial, ethnic, or cultural backgrounds. Again, that's a problem. Our shared prosperity is absolutely dependent on embracing and celebrating our increasingly multicultural, racially diverse state. And if we're in our own little cocoons, that's not going to work. So we need to name these barriers to greater civic engagement, and we need to lower them. Childcare, jobs without the flexibility to be engaged, transportation, language. These aren't mysteries. We know what they are. We can lower them. Second point, disturbing trends going in the wrong direction, and Yvonne named a couple of them. The last few years have been troubling when we think about the health of democracy, and especially this past year. I'm going to pose these as problems, but I'd like them, I'm going to do that so they spur ideas for how we could solve them. So the enormous rise of disinformation, bizarre conspiracy theories, and unfiltered social media, so we can't even agree on facts. The falling, not only trust in local news, Yvonne, but the capacity for local news. Local papers, community bulletin boards, radio stations have been absolutely starved for revenue. The decline in trust, and Yvonne covered that beautifully. The direct assaults and indirect assaults on democratic institutions. The rising instance of racism and hate crimes. And measures to restrict voting access rather than expand it. And the unbridled opposition to independent redistricting so we can avoid gerrymandering. So those trends are all going in the wrong direction exactly as we need to build our civic health for the reasons that Yvonne and others have named. So here's my third and my last point is that civic health is a prerequisite for everything else. Michael opened by saying that no matter what issues you care about, jobs, education, healthcare, the environment, social justice, civic health, and a just democracy undergirds them all. We just can't solve any of our other challenges without it. Civically healthy communities trust their local officials, they vote and they volunteer at higher rates, and they help their neighbors. That's why our foundation names civic engagement as a community need equal to all those other things, a clean environment and access to food and healthcare and education. We support many initiatives that work to increase trust, to increase connections, to provide trusted news, to bridge difference, but we all have to do more. So I'm going to close with this. New Hampshire has long prided itself on civic spirit, that individuals can make a difference, that you have a voice, that you show up to help run your community. I live in a little town with 1,200 people. There are 80 appointed and elected, almost entirely volunteer local officials. But that's not true for everybody. We have got to name the barriers and the obstacles that keep people from being able to do those things that make New Hampshire what it is. I like to think that this state that we all love should have the highest civic health index in the country. There's no reason this should not be the civically healthiest state in America. Our foundation looks forward to working in deep collaboration with all of you and many others to address those shortcomings, to work on those recommendations, so the next time we do this index, that's what it will show. A pleasure for me in this event has been able to connect once again with Pedro. So I have the great pleasure of turning this over now to a voice that, with all due respect to Yvonne and me, is probably more significant as we look forward to New Hampshire future. Pedro?
Thank you, Yvonne. That's kind of two acts very tough to follow, but I'll try my best. Just wanted to be the third to also thank Michelle, Quixada, and Bruce for the spectacular work that you guys have done putting this together. This has been very, very insightful work. And after looking through the report, there's a lot of positive things to take out of this. So I wanted to highlight a couple of those positive things and pick up where Dick left off. One being the connection and relationship between civic health, civic education, and education in general. Something that I wanted to bring to the forefront, just to start off with my points, is in New Hampshire, we have this uncanny ability to have such access to our legislators and so much access to our legislative process. It's important to note that while we acknowledge that education and civic health work hand in hand, there's much needed support of civic education within education. What I mean by this is there's oftentimes not enough encouragement for youth in education to pursue educational careers or careers in civic engagement. In New Hampshire, we have a lot of opportunity to pursue volunteer advocacy careers in civic engagement, but there's not enough emphasis from a very young age to pursue those kind of careers. Not necessarily in some people grow up wanting to be the president of the United States, but not often do I hear people wanting to be the town manager of Hanover or the mayor of Nashua. These are important positions of power because we understand as a civic engagement index has indicated that a lot of people are very, very immersed into their local politics. So we could be doing ourselves a great service by going into our schools and telling our youth and encouraging our youth to engage to be engaged civically, not necessarily as a state legislator or a state senator, but a town manager, a town clerk, someone to be a part of the school board, encouraging them to be in their SGAs or student government associations. These are ways that we can teach our youth how to seek importance and seek dreams within this space with ample opportunities to employ them. I think back to how I started my civic engagement kind of profession here in the state of New Hampshire, and I started out from the bottom. I was a person who really didn't know much about legislation or politics at all, and really didn't need to know much about them to really be engaged in this space. All I knew is that I wanted to be a part of my community, that I was a part of a community that accepted me, and they saw value in what my thoughts and ideas were because I was a part of that community. And that's really all it takes in the state of New Hampshire, is to be a person, to be a person of significance in this space, is to just be a person in general. You don't have to have a Ph.D. or master's to be the expert of your own life. And oftentimes it's a local person who becomes the town clerk. It's the local person who becomes the state representative. It's the same local person who becomes the state senator. So it's very important to emphasize the same way we do business schools, nursing, agriculture in schools for kids to pursue these careers, the same way that we should be definitely emphasizing these kind of supports for civic engagement in the state of New Hampshire. Which leads me to my second point is in millennials are often, as a millennial myself, an observation that was made that we are not very engaged with the greater community is because of the sense of belonging to the greater community. There have been multiple times where we have kind of witnessed millennials struggling to stay in New Hampshire because of other variables that keep them away from civic engagement. Things to highlight is housing. It's very difficult to find for millennials. Job security is hard to find, even more so now because of COVID. And these are the cost of education in the state of New Hampshire is also costly. So while millennials are trying to make ends meet and trying to survive in the state of New Hampshire, they quite literally don't have enough time between making ends meet and going to work to be civically engaged at the times that the civic engagement process is, open for the public. If we're looking at the way the legislative process works, we have the public hearings that often happen at 1 or 3 p.m. in the afternoon. not many of those people who want to be civically engaged can just immediately take the time off to be engaged in those hours. Oftentimes, when it comes to a very controversial legislative bill, like all bills are heard here in the state of New Hampshire, but when it comes to controversial bills, what you have is students who can't make it to those bills because they can't take the time off, or they do take the time off, they risk not being able to make a certain bill that they have to make, whether it be a phone bill, be rent, whatever it may be. And because there's so many people populating the space to have their voices heard, oftentimes the public hearing is recessed for another time. So people will line up to speak their voice, but oftentimes have to come back another day, which is very detrimental, very discouraging to those populations who really want to be involved and whose opinions and experiences are missing from the decision-making process. So there are other variables that impact millennials from engaging in this space. And it's important that we need to be cognizant of those variables if we want to allow those populations to be more involved in the civic engagement process. Upon one of those populations that have not really been given much credibility, not credibility, but has not been given much light to, which leads me to my third point, are diverse populations. An observation that was made in one of the other reports, I think it was a Fiscal Policy Institute report, was that the diversity of the children in the state of New Hampshire is much greater than the diversity of the state of New Hampshire as a whole, which means that our diversity is ever growing. For the last 10 years that I've spent here in the state of New Hampshire, diversity has gone up, small, but gradually. And that means that our populations are looking it's important for us to meet those populations where they are and make sure that those voices are heard in the state house chambers. Because of the diverse, we also see that in the report that in the most urban environments, there's not much civic engagement as well. So it's important to understand that while our population as a whole is becoming more diverse, we want to make sure that we allow those systems that give the opportunities to constituencies to be a part of the legislative process to be accessible to everyone. And that's what Dick was saying is we have a great opportunity because of the access that we have to our legislators, because of how the makeup of the legislative process is. We have an opportunity to be the most inclusive, the most diverse, the most accessible legislative body in the state, in the country. We have 426 legislators, which means there's 426 seats, 426 constituents representing many different populations who have an opportunity to be a state representative, which is incredible. You look at other states, you don't go, here in particular in New Hampshire, you walk to a Shaw's and you might bump elbows with your state senator. That's something that's unheard of in other states. So we have a very lucrative opportunity to be really inclusive and accessible to those populations that often their voices are intentionally and unintentionally left out. So with that being said, here in the state of New Hampshire, to be culturally relevant is to make people feel like they belong. And people already have their voices. They just want their voices amplified in the tables where the decisions are being made.
So if I could jump in here, Pedro, when we were talking about the Civic Health Report, I think we talked about these structural barriers that you're identifying, but also looking at kind of the mountain that is there to get to that place where everyone can feel welcome, whether it's education around how to participate and getting involved, or sort of removing the structural barriers that the timing of things happens. But I know, and as well as you do, that this year there's been a lot of pushback for low-income people with disabilities and people of color when they go to testify. And to Dick's point about media, they've been under attack from folks outside of our state, and it makes it even more difficult to begin to participate. So I feel like a lot of the struggle ends up where Quixada, her first reflection on how do we actually get people to be able to be in dialogue with each other, because it feels to me like where the center is really narrow and we're sort of pushed into camps of right or left, whether you believe whether you self-identify, that's a word we're using these days, into one of those categories, you're forced into a place, and then it's much harder to have good dialogue as a place to begin to make people feel welcome and comfortable, and then exercise their advocacy skills. So I think Quixada's reflection is really necessary. And, I think at the endowment, we're trying to work on how do we have those conversations happen. But to me, it feels like a bit of a mountain ahead of us.
Absolutely. And just to address another mountain that exists is our legislatures only make a certain amount of money per term. So when students and people are looking at being a legislator as a tangible career path, not many people can make a living off of the money that a legislator can make here in the state of New Hampshire. So that's to say that if we're looking to be more accessible and inclusive and diverse, there are barriers within the same accessible and great legislative process that we need to overcome. And if we have a legislature that is, not making that kind of income, that means that people are going to be deterred away from participating in that kind of landscape. And unfortunately, what we have here in the state is, who can truly afford to be at the State House from Monday to Friday, 8 to 5, and not work, 40 hours a week. It's detrimental to the populations that really want to be immersed in this process, to not be able to be paid for their advocacy, to be paid to be there. That's a big issue, is a lot of the work that goes into these organizations and these experiences that are championed by these organizations go uncompensated. And so people would want to, already surviving, want to make sure that they can stabilize their family, but don't know that, just like you said, the parallels to public health are the same to the parallels of civic engagement. If people don't have a sustainable source of income or a sustainable source of support, then it's going to be very tough for them to wanting to take time off from that in order to come and voice their opinions at the State House.
It's so interesting to me, because you think about how structurally, in many ways, the state is really well established for deep, deep civic engagement. So the idea of the largest legislative body in the country, in the House of Representatives, the citizens' legislature, that came from a time when the legislature only met every other year for about 3 months. So you could be a farmer, you could be a small business owner, and you could still afford to take a few months off, and maybe serve a term or two and kind of do your duty. So we've got the spirit, but it's completely not aligned with the realities of where we are today. Similar with town government. You've got as Pedro, you said so well, there's so many opportunities to be engaged and really have a voice and make a difference in your community, but we're not structured in a way so a working young person of color, a recently arrived immigrant is going to be able to take advantage with so the spirit is there. But how do we retain that spirit, but modernize it for who is living in the realities of what we have today? We're the only state in the country where every single bill in the legislature must have a hearing. I mean, I talk with friends around the country and they just can't believe that. And everyone who wants to speak out gets to speak out. But that then gets restricted either intentionally or unintentionally by daytime hearings, by limiting technological access, by language barriers and other things. So, Paige, would you mind if you said something when we were chatting before about staying in New Hampshire for 10 years, even though you said, I hope you don't mind me saying, you said you've been tempted a number of times to go back to Brooklyn, right? And but you said you've stayed, and one of the reasons is this potential to make a difference here. Would you mind saying a little bit more about that?
Absolutely. So when, again, I'll preface that by saying that in this space in civic engagement and in public health, being cognizant that there is a workforce shortage, it's important to note that the needs of those workers, of the youth, are disproportionate. The needs of the public health and the needs of the state are disproportionately placed on the youth, but none of their needs are met. So being a part of that population, oftentimes in this work, you know, it's instant gratification that comes very, very rarely. So it's time, you do a lot of this work, and oftentimes you don't see the change happening right before you. In the state of New Hampshire, there's the opposite, an opportunity to make that impact happen so immediately. And the reason that I want to stay is because New Hampshire has the opportunity to make this substantial change, and you have such an opportunity to be this involved. But the reason that people want to leave is because they want to feel belonging to a place that's culturally relevant. They want to feel like they're attached or feel belonging to the cultural art scene. They want to feel attached to a music scene. They want to feel attached to their neighbors. They want to be attached to these social spaces. And granted, we're in the age of COVID, but even before or after the age of COVID, people are there's going to be a renaissance of social capital happening. People want to be feeling belonged. And what we have now with social media is the idea and the definition of community is no longer geographically bound. People want to connect with different people. There's opportunity to learn about different communities, never lifting a finger off your armchair. So the reason I decided to stay, it's because something told me that there is work to be done here. That as a person of color, being a millennial as well, you know, also being a transplant, being from somewhere in New York City, and then coming here for opportunity, that there's ample opportunity, not just for myself, but for everyone else. And it's going to take everyone. No matter where I go, there I am. So I can't run away from the problems that are happening here and expect something different somewhere else. These same systems are in place in other places. But what's different and what is unique about New Hampshire is the opportunity to be this immersed, have this much access to civic engagement. There's so much opportunity to encourage our youth to be a part of this process. And there's a lot of opportunity in local spaces for people to take up these positions. So the opportunity is there, but it's very untapped. It's a well with a lot of depth, with a lot of water to nourish a lot of these things. But unfortunately, it really gets tucked under the rug.
Thank you, Pedro and Yvonne and Dick. I want you to keep the conversation going. I'm going to call in Quixada, and I'm going to call in some of the folks from our advisory board who've advised the Civic Health Index. So we'll get a few more folks on the screen, but keep us going. I think you were about to say something, Yvonne.
Yeah, I was. Where I keep ending up with this, Pedro, is that, you know, our desire to jump in as individuals, but the way that our towns work are collaborative. And so there's this tension between sort of the rugged individualist narrative that New Hampshire has, live free or die, yet everything that moves policy or moves change or makes our communities feel welcome happens collaboratively. And so there's this tension there. You know, we want to jump in as an individual, but we need everybody else with us to get across the end line, not to bring sports into this. But and the other thing is, with the dismantling of what we used to call neighborhoods, because we're so technically, you know, connected, and my neighborhood could be online, you know, Quixada, you said the other day, like values-based online neighbors in a community that's virtual. And what does that do to the physical neighbors that we have, that all of a sudden now we don't trust anymore? So I don't trust the person I live next to, but I need them for collaborative change in my community. And I don't define community the way that our legislative system was set up to make the rules under which we live. So I always find there's this tension. And I think it's sort of the rugged individualist. New Hampshire is kind of mythical, actually, because in the work that we do, it's always collaborative, and it's easy to collaborate because it's the same people all the time. You show up you're talking about topic X, and it's one subset of people, and half of them are also at a quote table, end quote, for topic Y. So, I mean, I feel like that, like, I was really disturbed by the findings in the report about not trusting neighbors. But I think there's work to unpack that with what do we mean by neighbor? What do we mean by community? And the fact that New Hampshire, we have to live collaboratively in order to make any kind of positive change.
Thanks, Yvonne. Other advisory board members, we want you to come in, but we can't pull you in without your camera being on. So know that we are looking for that to happen. Anthony just shared a question with New Hampshire ranking in the bottom 5 states in the nation in terms of connecting with people of different racial, ethnic, or cultural backgrounds. What does this say about New Hampshire in general? And what does it mean practically for New Hampshire's Black, Indigenous, and people of color community and our ability to thrive and prosper? So unlike Pedro, many of us are leaving.
And yes, that's an unfortunate reality because it comes at the intersection that I have come across in the 10 years that I've been here, you know, referring to Dick's question is, why did I decide to stay? It's simply also, what kind of work can I actually get done here to make an impact, and at what cost? At what cost is this going to be to me as an individual, to my family, to the aspirations that I have and the investments I want to make in myself and in my family and my future, to wanting to stay in a place where the resistance is so strong. So again, it's all about building this sense of community, is being able to understand that oftentimes the reason people leave is because they feel alone, this loneliness that doesn't attach to them. I have many a times have felt very lonely being a BIPOC in the state of New Hampshire, but I've found comfort in doing this kind of work because I see the desire to make the transition in making New Hampshire an equitable, diverse, and inclusive place. And of course, Rome isn't built in a day, but it wasn't knocked down in a day either. So it's going to take work. It's going to take persistence. It's going to take patience. It's going to take enthusiasm as well. And that's what we certainly need, but it's not something that we can force people to do. There are events in life that happen that take you away from this place. And there are certainly things that will keep you here as well. I particularly am highlighting the opportunity for people to come here if they're looking to make a change. The ground is fertile. The soil is fertile with opportunities and to find employment and civic engagement, and not just that, but also do very, very important work. There's not that many, the diversity in the state of New Hampshire currently isn't that big, but it's going to be bigger. So the best of New Hampshire has yet to come. It's whether or not you want to stay here to be a part of that change, or, you know, for better or for worse, you decide you want to leave. It is completely okay. It's, you know, it's not something that, you know, we can necessarily force upon people to take on and continue on this battle, but it's a battle worth fighting for sure.
Michelle, I'd also say that there's some new data coming out that I got a preview of as a member of the state health improvement plan process that actually is going to kind of help us start to drop the narrative that we're not diverse, because we're actually quite diverse as a state. We just don't want to believe it or something. That and in this meeting, I also reconceptualize how I think about demographic flow. So people leave and other people come. And what the data shows is the other people coming are more diverse, and people leave, but other people come. So the more other people come happen over time, that's when we'll really be able to claim our diversity. But this new data is coming out and it'll be published soon. And I think we're all going to go, what? That's our state? What? And we'll start to see we're more diverse, even all the way up in the mysterious North Country, which I love up there.
That's
and
great.
I say that as a kind of person who's always lived here, right? So
yeah. Thank you, Yvonne. Welcome, Anthony and Martha and Deborah. Go ahead, Dave.
One thing to Anthony's question. So that first question is concerning. What does this say about New Hampshire in general? And I've got a two-part answer. First is, I'm concerned that New Hampshire is 38th in talking with neighbors of any kind, which is and then that we're 45th in kind of talking across difference. So yes, we are becoming more diverse, but we are still one of the whitest states in New Hampshire. So part of the answer, I think, of course, I mean, one of the whitest states in the country, is that white dominant culture is going to take a longer time to step aside unless and until we all, and perhaps especially white leaders, really lean in. So, the fact that we're not talking about difference across difference and not connecting with people of different ethnic, racial, and cultural backgrounds, I think is embedded in a state where white dominant culture is lasting a lot longer than other parts of the country, to be honest. And then the second part about data, to Yvonne's point, New Hampshire's a weird place. For a while, we were the fastest growing state in the Northeast, third fastest east of the Mississippi for essentially 25 years, from about 1980 to 2010, or 75 to 2005, in that range. And then we slowed down dramatically. And now, as Ken Johnson, you guys know better than I from Carsey, has confirmed, we've got one of the highest churn rates in the country. So something like a third or a quarter of the population is turning over every couple of years. So what is community? And if people aren't getting connected to community, if you're only there for 2 years, you don't even meet your neighbors, that churn rate is something really new. And I don't think we have yet grappled with what that means as a state.
Yeah. Anthony?
No, I don't. I mean, that was one of the, I mean, I appreciate the responses. I think, and I agree with Yvonne, I think the state is more diverse than I think our ACS data or our census data will suggest. And I think it's precisely, Dick, for what you suggest, which is the in-migration and out-migration of folks. And I think it's happening so quickly, it's difficult to keep track of. I mean, for me, I think this really centers on, and related to my question, what I call the 3 Ps: power, position, and privilege, of which many people in our BIPOC community have little or nothing of. And so, while I think the numbers are relatively small, quote unquote, we as a state, we as institutions, we as communities and individuals can look at more inclusive practices, with diversity being the goal. Diversity is the end result, and inclusive practices are the tool by which we get there. And so I think that if we want to realize the gains that I think the majority of us do, and I think, I don't know how many people are on this call right now, about 100 of us, I'd like to believe that there are a good size of those folks who may be new to this information. I suspect largely not. So the question that I often have too, related to these kind of conversations, how do we bring people who traditionally don't participate in these conversations into them? Because I think, to going back to Quixada's point around education doesn't necessarily have to be formal, right? It can be a simple conversation, a cup of tea, or and simply just a conversation. And so, for me, and so it goes beyond just the issue of race and ethnicity. It's about power and people's inability to share that power with those who they may not know. And if you don't make an effort to get to know, that power will never be shared. So I'm a big fan of town meeting as well. I mean, I was just in Groveton's town meeting last week, sitting down there, enjoying and having these conversations. But again, people have to be willing to let go of that. And I don't think that the systems are set up to allow for that. And I wish those who were in those positions, who had the ability to change the narrative, did so, or at least at a minimum were willing to invite others into the conversation. But I just don't see that a lot, and beyond just the surface level. You right? I'm sorry, I talked too long, forgive me.
No. Sorry, I thought you, I apologize for interrupting. Thanks, Anthony. Yeah, let me bring Deborah Schachter in. I know that she had a thought, wanted to connect to what you were saying.
Well, there are just so many threads that have been raised today in this conversation. But one thing I wanted to raise, because I think it's a challenge for all of us, is that as we identify the vision of folks who've participated today, it's a vision of engagement that is essentially pro-democratic. It's inclusive. It creates a seat at the table for everyone. It elevates voices of youth and others who've been heard less or not heard at all. But we know, particularly from the events of the last year, that we can't assume that engagement or action advances our civic health. That engagement with news might be engagement with reliable sources or with conspiracy theorists. That showing up might be showing up for a peace rally or a hate march. And so I think we need to just challenge ourselves. It's just really an observation that if we're going to advance the vision, and I agree with all the other speakers about how central this work is to everything else that we care about, then I think we need to kind of continue to challenge the field and challenge ourselves to think about how we get to that nuanced understanding of when engagement advances our shared goals and when it actually might be working against them, and how we grapple with that.
Yeah, thanks, Deborah. Martha, yeah.
I just wanted to build off of something that Pedro said about how we've really neglected to teach civics and civic engagement and politics and that whole career path. It's not really just a career path, it's actually for the job of being a citizen, which everyone needs. So whether you want to be a politician or not, everyone needs that to participate. That's what we need. That's sort of the foundation of our system. So we assume people are going to be informed and engaged, and they're going to have good intentions. They're going to have civic virtue, right? There's so many things that we've neglected because we've been so focused on career and college and jobs and that's great, but that's all about me, and I'll move from here to there to there to there to pursue my career for myself. But a real lack of guidance, I think, really from kindergarten on, about what the part that each and every person plays in their communities and in their state and in their so I want to thank you for asking those questions about civics education. And I also wanted to say that media literacy is critical. It's just a critical thing that every single teacher now needs to take on. Also, Diana Terrell has a new study. She's a professor of education at St. Anselm, and she found that there was inequity in pedagogy as well in New Hampshire. And so that the less resourced towns were having a much more like a rote kind of civic education, whereas the towns that had more resources and had access to more professional development and all the curricular materials, they're teaching an engaged civics education that promotes engagement and activity and participation, and those kinds of skills. And there's knowledge, skills, and attitudes, right? So if you just stick with the knowledge, it doesn't necessarily impact you one way or the other, because you'll just forget it after the test. So there's a real inequity in that way too, in terms of the pedagogy. And I also think we need to train our teachers and protect our teachers when they try to have those conversations in the classroom about controversial issues. We need to train them how to do that. It is possible to do that without losing your job.
Yeah.
So all those things are just so very important.
Thanks, Martha. I didn't know if Will wanted to connect to your comment on journalism and millennials, but I'll give Will space and then invite Dean in as well.
Thank you. Yeah, no, it was disappointing, in reading over the report and hearing, it discussed earlier about how millennials are less civically engaged than other generations, not voting as much, attending fewer meetings, not really paying attention at all to traditional news sources. And one of the conclusions that was drawn in the report, maybe speculations, was saying that millennials are likely not being heard by elected officials as a result, because they are less engaged. And I think I mean, that would be problematic, I think, for any generation, but I think it's particularly problematic here in New Hampshire for young people, in that, New Hampshire has the oldest average legislature in the country, here. I mean, and this legislative session, we have more young people than ever before, and yet we are still the oldest average legislature. And, that's a problem, because, the people who are making public policy do not have the lived experiences that young people do. Most of them didn't graduate with student debt. Most of them already own their homes, so they're not struggling with renting or finding a home to buy. They're not struggling with finding childcare. And so a lot of the bills that are in the legislature this year, for example, that deal with all of those things are, they've been, ITL'd, voted inexpedient to legislate. And it's a struggle, so it's very much a challenge at Stay Work Play. Of course, we're all about attracting and retaining more young people. We're working to connect young people with their legislators and encouraging voting as we did back in the last election. But it's an uphill battle, and one that's going to be playing out. And even if we're able to make some gains, it's going to be years before we start to see those public policy implications. And to turn that ship, it's going to be slow.
Thanks, Will. Dean?
Yeah, thank you. I really enjoyed listening to the conversation this afternoon, and I've been thinking about it a little bit longer term over the last 15 years or so. Some of you may know that Micah Stark, who's on this call as well, and myself, did a version of this kind of index back in 2006. And what strikes me is the extent to which there's actually a lot of continuity in the results. There really are some structural features to civic life in New Hampshire that I think are still there. And those are things like, education level, affluence, demographic characteristics of our population, some of the impact of the rural lifestyle, even though we are seeing some changes in some of our urban cores in the state. And the question for me is some of the loss of trust and the other changes that we see in the data, knowing that this data is from 2017 to 2019, which obviously corresponds with the Trump administration. I guess what interests me and what my question will be over time is, are these changes, these negative changes we see in the data, are they transitory in some sense? Are they an artifact of the Trump administration and the polarization of our discourse that we saw at that time? Or are these going to be longer lasting? So in a sense, we started off with a medical checkup metaphor. Have we experienced a cold or a mild flu over the last few years? Or is this some sort of chronic illness where we really need to work to make some underlying structural changes in how we think about community? I don't know what the answer to that is. I know that teaching civic engagement and civic education in New Hampshire, as is true elsewhere from people I've talked to around the country, there just are some real challenges. It's become very politically charged. We saw Republicans in the state legislature introduce that bill to block teaching critical race theory and issues of racism and white supremacy as kind of a conservative pushback. There are these long-standing beliefs by some individuals that, civic education in high schools is a form of progressive indoctrination. So there are all these kinds of political challenges that I think people will have to face and grapple with if it turns out we need to make longer-term structural changes. But what struck me was the extent to a lot of what we're seeing now is not that far off structurally from what we saw back in 2006. It's just this kind of impact of the last 3 or 4 years. And I don't know how long that's going to persist in the data going forward. Yeah. Thank you.
Thank you, Dean. Anthony. Oh, sorry.
I was just going to jump in on the medical metaphor, Dean, that you don't want that flu to turn into asthma, right? So you go to the doctor, you get a checkup, and if you need to take some vitamins, you do it. So I sort of say, we've had a checkup. We need to get on it. We don't need to wait to decide that this is an anomaly.
All right, Anthony, and then Pedro.
Yeah, and I just wanted to build on a point that Will makes. I think that really matters. And so, for example, as a state, we are grappling with the lack of affordable, safe, clean housing, right? As an example, we also notice this is one of the biggest impediments or headwinds we face in terms of our economic development as a state, right? To your point, Will, about lived experience and those who represent our interest, 4 of 6, I'm looking at it now, I just pulled this from some reports, 4 of 6 of the bills in the legislature today related to housing have failed. Either they've been tabled or it's some 4 of 6, right? We know this is a major impediment to our growth of the state. So to your point about lived experience and the disassociation between those who are making the policies that have a direct impact on the average citizen, I think this is a perfect example of that. I think the other example of this is, for example, the recommendations made by the governor's task force on policing and those reformations there. You know, they had put forth the need to collect data. What happened? The legislature said, no, we don't want to do that, and voted it down. So I don't think we can have it both ways. And I think we need to decide which side of the fence we want to be on, the one of righteousness or the one who maybe doesn't want to be on that side.
Thank you. All right, we're getting close to time. Pedro, and then I want to call Quixada back in here as well.
I'll be super brief. So in observation to everything else that I ever heard here, especially in particular, just kind of very briefly on the screen, looking at the report, something that I wish for the next report to come out is civic engagement from the legislators themselves. So I think that there's a difference between civic engagement and then civic participation. Our legislators are participating because of the seat that they have in the legislative process. And often we are encouraged to go seek out our legislators to go talk to them. There is a bi-directional relationship that exists in the legislative process here in the state of New Hampshire, where our legislators can also, because they are generalists, can seek out information from their communities. And oftentimes legislators are looking for what they want to know, not what they don't know. And so working in the state of New Hampshire in the last couple of years, we're always encouraging to be the people, the informants to our legislators. How often do we have legislators speaking in this space or populating in this space? Because we can talk about all of this to each other and we could all be in alignment and agreement, but the people who don't share these same views or have views of dissent are often missing from these discussions. So how can we perhaps encourage our legislators to be active representatives of the ever-changing ideas and concerns of their populations, to be involved in those spaces where these populations are going to? So that's something that I wish that the report could perhaps show in the future, is maybe saying how civically engaged are those civic participants.
Thank you, Pedro. Quixada, I want to, if we were in the room together, we could have done this all day long. So I really appreciate those of you who've been able to chime in and really spark this conversation. There's a lot in there. Quixada, I want to give you a chance to just highlight a few things that are next steps, and then I'm going to end it with one of Bruce's favorite quotes. So,
sure.
Go ahead.
Thanks, Michelle, and thank you, everyone. I've really appreciated this conversation today, and it obviously needs to continue. We're at time, and I feel like we've just started. A couple themes that I saw today. It seems like we need to have more conversations about millennials, and youth in the state, about education, and about the connecting with people across race and ethnicity. So it seems like there's sort of 3 conversations that need to keep happening. One other theme that I heard is that we can interrogate the way that we do engagement and do it differently, right? And that was a theme I heard from the conversation, is that just because we have done things a certain way in the past, we don't have to continue things like unpaid service. We don't have to continue things like public meetings that don't actually engage people or make them feel like they have a meaningful say and aren't worth their time, right? So I think that we have a moment right here. There was a comment in the chat where we're doing more digital engagement, and it's also just sort of a natural cut point for us to maybe start thinking about doing things differently. So we can flip the script on how we do engagement in the state, and I think we should. The other point that I wanted to bring up, which was a point you mentioned, Yvonne, earlier on, was that the people who are the least engaged in the state are also the most vulnerable in a lot of ways. And so we need to think about how to bring engagement to those populations and how to do engagement differently so that we reach those populations, because that's really, really critical, I think, to the civic future of our state. In terms of next steps, I wanted to just surface a few. We were going to do a poll, but I think probably, Michelle, at this point, are we going to elect not to do the poll?
Yeah.
So I'll just kind of read some pathways that we had brainstormed that might be paths moving forward. One would be establishing some kind of a statewide civic advisory council, and maybe even building on some of the existing structures that already are intact, like the Civic Education Committee in the state and things like that. Another would be maybe having more focused talks on specific parts of this report, you know, like the topics that I mentioned: millennials, education, race and ethnicity, et cetera. I think that New Hampshire Listens is always willing to try to jumpstart community engagement. And so you could follow up with Michelle about conversations about engagement at the local level. We've got also this civic engagement primer that people can use to encourage local data collection around civic health. So that's another next step. And then I think that we have an opportunity to maybe create some civic intervention projects across the state. Or civic projects within the respective organizations that you work within. So I know we can't totally process that right now, but I'm just throwing it out there, and I do hope that you follow up. Michelle, would the sort of most logical point of contact be for them to follow up with you?
Yeah, that'd be great. I'm in the chat. So thank you, Quixada. And thank you all of you. I really deeply grateful for your thinking, your reflections, and I believe I've heard Bruce quote Terry Tempest Williams many times, but I will close us with this quote. The human heart is the first home of democracy. It is where we embrace our questions. Can we be equitable? Can we be generous? Can we listen with our whole beings, not just our minds, and offer our attention rather than our opinion? And do we have enough resolve in our hearts to act courageously, relentlessly, without giving up, trusting our fellow citizens to join us in our determined pursuit, a living democracy? Terry Tempest Williams. Thank you all so much. Really appreciate you being here. Keep in touch. And again, Quixada, thank you so much for your work. Really appreciate it. Thanks, everyone.
Thanks, everyone.